School Arts Program on Instagram and Facebook.
You are now listening to Spark FM. Join us on Facebook and Instagram at sparkfmonline.com.
Are you tired of renting and need more of your own space? Are you getting stressful letters or calls from the bank? Does your home require expensive repairs and you just don't have the funds to fix them? Regardless of whether you want to buy or sell, Tayla Andre of Thumbprint Realty is here to help. From saving your home from foreclosure to walking you through the process of becoming a first-time homeowner, Tayla makes real estate easy. With your best interests at heart, knowledge of the market, and a passion for people, Tayla is dedicated and motivated to serve you.
Good rising, good afternoon, good evening, or good night. I am Tayla Andre, and I am determined and dedicated in assisting you in all of your real estate needs. Give me a call at 617-459-0041. Again, that number is 617-459-0041. Or you can email me at TAYLAANDRE@thumbprintrealty.com. Good rising, good afternoon, good evening, or good night. I am Tayla Andre. Waking up with Tayla Andre has absolutely nothing to do with the time of day we link up, but about waking up your third eye with unorthodox conversations leading to universal consciousness. Today, we have Baby Rain's doctor in the building. Dr. Neel Shah is an assistant professor. He is listed as one of the 40 smartest people in healthcare. He has been profiled by the New York Times, CNN, and a host of other outlets. You probably seen him on Instagram in a video talking about Black women in health when it comes to giving birth, losing our lives. He spoke when Serena Williams went through her ordeal when she gave birth to her daughter and the racism or the lack of attention that she received as a professional, a rich professional, high profile, and still going through the BS when it comes to Black women's maternal health. Good rising. How are you?
I'm great, Tayla. It's good to see you. I think the last time we did this, we were in person and I had your baby on my lap.
The baby, he's huge. He's 2.5. He is super intelligent, yet he hasn't learned talking yet. We're not there. He hasn't learned the difference between any of his, like he knows the letters, but like A through Z sound like, oh. So we haven't figured out how to do the pronunciation thing yet, but I did sign him up for early intervention, which I am absolutely not a fan of at all. But so if you have any tips, tricks for us as far as young people learning to talk, I know that's not your specialty, but I am open to all suggestions.
Well, it's not my specialty, but and I'm sure it's very frustrating to have thoughts that you can't express. But I'm also just glad to hear that he's getting big. And one of the biggest joys, I think, of parenthood is just getting to witness that whole thing. And it's been years, so he must be, he was a baby in my lap, I think, when we were doing this interview last time. So that's just exciting. So congratulations to you. And I hope he's
Thank you. And you as well. How are your little people?
They're good. So mine are 2 and 4 and running around the place and chaos and all that, but it's good.
Of course. Well, let's start all the way from the beginning. Why medicine? Why OBGYN? Why women's health?
Is the beginning. Yeah. Okay. So I signed up for medical school really young. I was in high school and I applied for a program that basically you decide that you're going to go to medical school when you're only like 18. And I only knew about medicine from TV because I was only 18. So like everything that I thought was based on TV. And then I found out when I was a medical student, I was like in 25th grade or something, when I finally got to like be in the hospital and have a white coat and take care of real patients. And what I learned really quickly is that there are things that are like TV that are very inspiring when you see the full range of our capability. And then there are things that are really disillusioning that just like don't work for people, that our systems are broken, as we know, and humans are fallible, like we make mistakes. And so that was that disillusionment during medical school led me to step away from med school for a number of years and do other things before circling back. And while doing other things, what I found is that I never thought I was going to become an OB/GYN. It was the last thing I ever thought I was going to do as a man in my 20s. But I think everybody who is in women's health cares about social justice. There's no way of doing women's health without caring about social justice. And I wanted to be more like those people. I don't even think I understood that link. I just knew that I liked the people who were doing it, and I wanted to be more like them. And I liked delivering babies because you have to have no soul to not think that's cool. So that was good enough for me. And so that's how I ended up doing this.
So you love delivering baby. Well, actually, I never knew that about you, that you walked away from medicine. So I want to know, for my own personal reasons, like, why did you walk away from medicine and what brought you back?
Yeah, I mean, I always thought I would come back, to be totally honest. I don't want to make it seem like, I was more rebellious than I was or something. But I got through my third year of medical school, which is when, your job is to open up every door in the hospital and figure out what happens inside. And so that, behind a lot of those doors, I saw that systems were designed to not serve people as well as they could. And I didn't know what to do about that. I'd only been a student. I'd been a student my entire life. And I thought there was a missing part of my education. That was my best way of understanding what was going on. So I left, but I left to go get a different degree. I went to the Kennedy School of Government at Harvard because that was a place where I thought, if you're going to change things, go to Washington, change public policies. That was what I was thinking. So I ended up there. And then it was the mid-aughts. It was like the mid, like 2006 or so. It was the end of the Bush presidency and the beginning of the Obama era. But while I was there, in like 2006, 2007, everyone thought Hillary Clinton was going to be president. And meanwhile, there was this freshman senator from Illinois who had no business running for president. And I was among the people who was like, dude, whatever you want, if you want coffee, I really believed in his vision and signed up really early. And so that kind of drew me into when he was elected, there was a whole transition, and a lot of my professors were helping with his campaign and then with his, early administration. So that drew me into public policy. And then before my medical licensing exams were going to expire, I decided I'd go back and finish my training. So my classmates went to the White House and got to do all that. And I went back and I became an intern in the hospital.
Well, thank you for sharing that, because I was completely unaware previously. We've had multiple interviews in the past, and that was a part of the interview that we never dove into. For those who do not know, what are the numbers, what are the statistics when it comes to maternal health, and what are those statistics when it comes to Black maternal health?
Tayla, the story of maternal health in the United States is a pretty damning one. And the thing is, the well-being of moms is sort of a bellwether for the well-being of society as a whole. So I just want to emphasize that, because I'm sure you've got listeners who are moms themselves. And I'm sure that all of your listeners care about the mothers in their lives. But often, the well-being of moms is cast aside. And it's because I think people expect moms to put their own well-being last, to put their families first. But even moms themselves sometimes kind of put their own well-being to the side. And our expectations are pretty low because we've defined good in terms of not getting injured in the process, which is a really, really low bar. Like, people have goals in childbirth other than surviving the process. But it turns out we're not even doing that well. So in my lifetime, the odds of surviving childbirth have gone down. In fact, an American today is 50% more likely to die in childbirth than her own mother was. And if you're Black in our country, you're 3 to 4 times more likely to die than if you're white. Those are the numbers.
How did we get here?
I think part of what's really heart-wrenching about this is that we don't have a complete answer because we didn't even care enough to pay attention. So maternal mortality, which is the number of people who die from pregnancy-related causes every year, has been going up for 25 years, Tayla. 25 years. Like, it's not like this just happened. It's been 25 years that it's been going up, and not by a little, by a lot, by 50%. And none of us were reading about this in the headlines. We didn't even know about Serena Williams' story. Of course, that broke around the same time as people were talking about maternal mortality. But that was only 2018. That was only 3 years ago. And the reason is that we weren't tracking it. Our country was not systematically tracking maternal mortality. And so, one of the first things that we had to do is, I use that public policy training and go to Washington and set up a system to make sure that we're at least paying attention to it, because you can't fix what you don't see, and you can't see what you don't measure. And we weren't doing any of that. But I mean, the answer is racism. The answer is racism. The answer is that it's not just that racism shows up in maternal health. It's that one of the most stark indicators that racism is a clear and present danger to people's lives is maternal health. It's like incarceration rates, maternal health. You got a disparity that's 3 to 4 times. Doesn't matter if you're Serena Williams, doesn't matter what your education level is, doesn't matter how famous you are, it doesn't protect you. That's racism.
So what does overall, what does that mean to maternal health? Just mothers that have C-sections that end up dying during C-sections, or is it I have no words right now, because you said for the last 25 years, mortality rates have been increasing, but we have not been paying attention. But when you take a look at all of the statistics that we measure other countries by, maternal mortality rates is one of them. And so we're here pointing fingers and judging all of these third world countries when we ourselves for the last 25 years have not been paying attention.
That's right. And not only that, those third world countries have been doing better. So in sub-Saharan Africa, maternal mortality has been going down. And in the United States of America, it's been going up. And I think the best explanation that I have for this is we see this in our daily lives outside of maternal health. Inequality in our country is getting worse. That's what's happening. And so, we can talk about how racism plays out in maternal health. There's structural things, there's systemic things, there's interpersonal things. We can talk about how, when a mom comes in labor, let's say, or is pregnant and has a concern, or really has any other kind of health care problem and expresses that concern, especially around pain, the healthcare system is slower to respond. That's the kind of racism that I think is familiar for a lot of Black people. It's pervasive. It happens all the time. And at least the very fact that you have to wonder, right? But and I think that you and I have talked about this too, you feel dismissed more often, and it seems like your concerns aren't being taken as seriously. So there's that piece of it. Then there's the fact that the way that medicine is practiced systemically builds things in that makes it less likely for Black people to get good care. Mm-hmm. And we can talk about that too.
Yeah. So I was reviewing our last interview, and I remember asking you about the father of gynecology and whether or not as a student you remember explicit bias towards Black and white. And you said, no, not really. Being in the field, these last 3 years, a lot has changed. A lot has been brought to light. What have you seen, or what has opened your eyes to what students may be learning, what you see in hospitals? Is there anything that you would like to share now that wasn't apparent then?
Yeah, that's a great question, Tayla, because there's this whole thing about fish and water, where one fish swims up to the other fish and is hey boys, how's the water? And the other fish are what the hell is water? You can't see when you're part of the system is the point. And there are a lot of things that I think that I took for granted that I didn't see as racist that I do now. So for example, if you're checking to see if a person is anemic, there's a cutoff for a person's blood count where it's normal. And then there's a cutoff where you're anemic, your blood counts aren't high enough. And if you're Black, there's a different level than if you're white. And so here's the thing. That's based on collecting statistics about what the blood levels are in Black people and white people. And for a long time in medicine, we've assumed that that's because of biological differences instead of it being due to racism. And then what happens because of those different cutoff points, you're less likely to intervene. You're less likely to care for a Black person the way they might need to. And so, those are just things that I was taught. And I think this assumption that race is biological as opposed to something that somebody made up because it was convenient for them is something that I think a lot of us are sort of learning and also unlearning things that we were sort of brought up with. And things like Marion Sims, the father of gynecology, they seem like they're in the distant past. But I think one of the things I've learned in the last couple of years is that medicine as an institution grew up at the same time as slavery, and that the job of doctors, in 1619, and well beyond it, actually, for most of American history, if we're being honest, was to put a price tag on people's bodies, on their ability to reproduce, like to put a price on it. We use people's bodies as commodities, and there are a lot of things that were baked into medicine as a result. That's undeniable.
So what is the water cooler conversation today when it comes to doctors? And what is being changed? Like, as far as policy is concerned, what are you seeing on a policy side that is changing? And I know there's a lot going on here in Massachusetts. Shout out to Representative Liz Miranda. What are you seeing, and what are the different conversations that are happening internally?
That's a good question. And I like the way you put it as water cooler, because everybody wants to be a good person. Let's just start there. Well, most people. I think there's probably some people that are truly terrible, but I think most of us want to be good, right? And then if you sign up to be a doctor or a nurse, you take an oath and you take that really seriously. In fact, honestly, Tayla, you take it so seriously that if there's a freaking pandemic and there may or may not be enough masks, and you're seeing people get very, very ill and even die, you go and you show up for work anyway. So I just want to highlight that. That's what we saw in the last year. There's a lot of heroism and there's a lot of mission-based, faith-based work in what we do. And it's about wanting to be good. The problem is, and the way that I think about it, at least as an obstetrician who thinks about systems, is that we need to start thinking about things like empathy and trustworthiness, not as virtues only that separate good and bad people, but as outputs of systems that either work or don't. And there's a lot about the way that medicine works right now that puts barriers up in allowing us to empathize with people the way that we should, or puts barriers up to being trustworthy, especially when there's a long history of not being trustworthy for a lot of communities out there. And we're seeing that again with the pandemic. I think the water cooler conversation is that there's a new receptivity to using words like racism, which, you mentioned, that I started talking about this a couple of years ago in some of those news things that you were mentioning. And using the word racism was not well received, put it that way. When I showed up on some of those media outlets and said that in 2018, much of the world, including my colleagues, were not ready to hear that. And I think a big shift in 2021 is, yes, we're all taught that racism is evil, so it's hard to recognize in ourselves. But right now, we're starting to do that work, I think. Not everybody, but in some places. So that gives me a lot of hope.
What is your experience as far as, so we have a pandemic going on. We currently have a vaccine. And so I know maternal health is your specialty, but just being an MD overall, I do have more trust in you, unfortunately, than I do in the person who is federally representing us as far as medicine is concerned. And so I just have a couple questions as far as the rush to produce a cure, and not even a cure, because the vaccine doesn't cure the reason why we're in a pandemic. It's not the cure. And so Was it or is it a concern internally? Like, are doctors concerned that we really don't know what the side effects are? We don't know what the long-term effects are. I know specifically here in Boston, we did have some trials take place, and it was just like, hey, Black people, do you want to come take this trial? We got some money for you. And a lot of, like, it was really difficult for them to get people of color to take the trial of the vaccine. And so we don't have the most data when it comes to people of color, nor do we have the most data when it comes to overall, because we haven't been testing it for 2 years. So how do doctors feel about the warp speed of the vaccine? And like, are doctors taking the vaccine with confidence? Like, how is this for you all?
These are such good questions. And I guess one thing that we should just say off the bat and put out there is that COVID-19 took every inequity in America. Did I cut out for a second?
You did, but we got you back.
Okay. I was just saying that, COVID-19 took every inequity in our society and threw it into a pressure cooker. And it's because it separated the whole world into people who had the ability to protect themselves from it and people who did not. And that was true, like, from neighborhood to neighborhood within the greater Boston area and in many other cities, where, like, the hardest hit part of the greater Boston area was Chelsea. Why? Because most of the people who lived there had no choice but to show up for work. I can talk to you on Zoom from my home right now, but a lot of people can't, including a lot of the people that are helping maintain the building that I'm sitting in right now. They've got no choice, and includes people that are well above the age threshold to get the vaccine and can't get it because to get it, you have to refresh a computer all day and they have to work, right? So this is the thing. Like, there's some people who couldn't protect themselves because they had to go earn money and their jobs meant being in the world. And then they would go home to multi-generational housing where you got, a worker living with kids and also grandparents who are really vulnerable. And so, like, that community got hit really, really hard. The community where I've got family in Jackson Heights, Queens, at one point was ground zero for the entire thing for the exact same reason. So it's just worth acknowledging that, on top of all the historical reasons to not have trust in the system, we're talking about a vaccine for a thing where the system left people behind yet again. And so I guess that's maybe a way of setting up what I believe, which is that it's not the job of Black people or anyone else to be more trusting of the system. It's the job of the system to be more trustworthy. That being said, among doctors, this is a good vaccine. It's like, it's honestly, it's as close to a miracle. The fact that we're 1 year into this pandemic and now we've got 3 or 4 of them, 3 or 4 vaccines that all work so well. I think everyone who's a clinician, especially people who've seen up close some of the really harrowing effects of this pandemic, and people who understand how the vaccine works, people of all identities, the minute that they could sign up, they got it. Mm-hmm. And I'll be honest with you, it's like, it doesn't feel great. Like it goes in and, there are people out there saying it's not a big deal. And like, that's not helpful either. Like, it's like the flu shot and a little bit, some people are totally fine. They feel nothing, but a lot of people, like, you feel it, but it's way better than getting COVID for sure. So among people who are in the profession, who are on the front lines every day, there's confidence in it. But I know that's not enough to be trustworthy. And I think to be trustworthy, what we need to do is have people like you who are willing to have conversations with people like me.
Did you get your COVID test? I mean, your COVID shot?
Yeah. I got vaccinated a while back in kind of the first batch because, I take care of people who are pushing babies out. So they're breathing really heavily and, have been on the front lines every week. So I got my vaccine as soon as I could because, every day I come home and I wonder what I'm bringing home to my family and my kids.
So this is like, aside from everything, is it true that germs can't live in cold?
Nope, that's not true.
So why are hospitals so cold?
I don't know. It's a good question. I don't know.
Yo, I've been lied to since I was a child. It's like hospitals are so cold because germs can't live in cold.
No, they definitely can. I mean, there's some like diseases and infections that, like, we all see this every year with the flu. Like, some of them do better in the cold, and then there's other things like malaria that do really well when it's warm out. But no, you can definitely get sick when it's cold.
Okay. I don't know why that question came to mind, but so I want to go back. So I've been watching. I know I have no plans on getting pregnant. Baby Rain ruined that for me. He is super energetic, and at 37 years old, I'm like, I'm good.
Yeah.
I need, like, if I was to get pregnant, that could be a real mellow child that don't want to do books. But I've been watching a lot of maternity and a lot of outside of the United States, what maternity looks like. And in the last show that we did together, you were talking about, we discussed how you were in Amsterdam.
Yeah.
Was it Amsterdam? And it looks like a bedroom, as far as like the birthing center looks like a bedroom. Why is America so far behind when it comes to developed countries and even the undeveloped countries when you look statistics? Just as far as the comfort. I remember being at Beth Israel and just, it's cold, it's uninviting, it's not, somewhere that you actually want to give birth. Like, the environment is a turn off completely, and you have to like turn the environment into something that's more comfortable and something for you to like want to give birth into. I had an amazing, like, my family went ahead and transformed the whole room, so it was like we were in Amsterdam. But what is it about America that we are so far behind?
Well, Beth Israel and every hospital, they're hospitals, so they're designed to take care of sick people. And people who are pregnant can be sick, but most people who are pregnant are healthy. And having a baby is, there are only two certainties in life: the beginning and the end. And so, we've messed both up in similar ways by acting as though there's something unusual. Like, the only things we know about life are the beginning and the end. And so these are normal processes that deserve support rather than I think what we currently do, which is kind of over-intervene. I think the other thing too is that both at the beginning and the end, and particularly at the beginning, like, people have goals other than simply, at the end, people have goals other than living longer. They do. And at the beginning, people have goals other than like not getting hurt. They want to be treated with dignity. They want to understand what's happening. They want to have a say in it. They want their input to make a difference. And yeah, I guess for a long time, it's not just about, the bed is nice, and the birthing center in Amsterdam is gorgeous. It's when you visit it, you're like, and then you compare it to a lot of hospitals, you're like, well, if I could deliver here, I would want to. Like, this is much more, and one of the big differences is like the person giving birth is at the center. That's the other thing. In our hospitals, they're designed for the doctors and the nurses.
Mm-hmm.
So
how does one, being a doctor, how do you want for me, the patient, to tell you that I don't feel like you're, like, how does one advocate for themselves when a doctor, quote unquote, knows best, but I've known my body for this, in like, case study, or examples in a book, but I know my body and I know what I feel, and what you're telling me isn't what I'm feeling. How, when you have a circumstance like that, how do you really advocate for yourself to actually be heard?
I feel like I get asked a version of that all the time. And I always want to be careful and thoughtful about not making it seem like it's the job of people who are pregnant to like pick themselves up by their own bootstraps. Like, on one hand, yeah, I need to answer your question so that if there's somebody who's listening who's in that situation, they've got something and they know what to do. But mostly the job of fixing this is our work on the clinician side. And the shared enterprise is just to realize that childbirth is a team sport. It always has been. Like, gorillas deliver their own babies, but Homo sapiens, humans, do not. Like, we need help. Like, we evolved big heads and hands at the same time. Like we help each other out. And that means that there's a complement of two kinds of expertise. There's your lived and embodied experience. Like nobody can tell you how much energy you have to push other than you. Like I don't know. And at 3 a.m. in the middle of the night in 2021, there's no technology that tells me how big the baby is relative to the pelvis. Like, like there's no way. Like I need the information that's only in your mind, and what you want matters also. But then I do bring not just the textbooks, but I've delivered at this point thousands of babies. And so I can bring that insight into what I believe is going to happen. And at the end of the day, it should be a shared decision. That's the ideal. But let's talk about when it goes wrong, like when you feel like you're not being heard. Now that's tough. And I said, I don't want to put the burden on the person giving birth to have to advocate for themselves, but sometimes, honestly, you do. And that requires a couple things. It requires elevating our expectations over what we deserve. So that is harder than done. And I know that they're or easier said than done. And I know that there are power dynamics always in those rooms, especially if you're in labor. But the one thing you can always say, I think, that would make a difference is if you feel like you're not being heard, if you were to say something like, I know this sounds really common or routine to you, but to me, this feels really different and I'm scared or I'm concerned. I think that would be, for most clinicians, a way of like hitting the brakes for a second and pausing.
Say that again. I want people to be comfortable with what you just said so they can practice for themselves.
Okay, well, and let me say too, like most of what we do, because it's a natural process, is tell people that things are okay, right? Like pregnancy is uncomfortable, labor is uncomfortable. And our job is to tell you whether or not that uncomfortableness is quote unquote normal or something that we expect or not, right? So a lot of the mentality of a person like me is to reassure you that, yeah, I know you're uncomfortable, but like, this is what we see. And so you need to get that person to be like, yeah, this is what you see, but for me, this is different. That's what you have to get across. So if you were to say something like, I know this sounds like something that's really routine for you, but for me, this feels really different and I'm scared or I'm concerned. That would make the person pause, I think, in most cases.
What is one of the, like, as far as maternal health is concerned, what are some of the things that are most alarming to you as far as where we are in society and in childbirth, or like the ideas that or ideals that we have surround, like what concerns you regarding like where we are mentally as a society?
I think that, birth is about general justice in society. It's a matter of gender equality. It's a matter of racial equality. It's even a matter of like geographic equality, honestly, because we've got 1 in 5 American families living in rural parts of our country that have to drive hours to get adequate care. And I'm really worried about, Americans that are living in the middle of Oklahoma too. It's also a matter of justice in terms of generational justice. The fact that both presidential campaigns were about this idea of generational justice. One was Make America Great Again. The other was like Build America Back Better. But both were about this idea that like hope and opportunity in our country are eroding. And we see that when an American is 50% more likely to die than her own mother. So what concerns me is that these are deep structural issues that you can't put a Band-Aid on. You actually have to totally reform society to get to the root of inequality and what's driving more and more inequality over time between the genders, among race, among people who live in Oklahoma versus people who live, on the Upper East Side of Manhattan. That concerns me because you can't fix maternal health without realizing that maternal health is just a manifestation of those two problems. Here's what gives me hope, though. I think we have a moment where we're talking about things like racism in our country in a way that I've never seen in my entire life. It was such a push to try to get one piece of federal policy out there to just measure maternal mortality in 2018. And now we have something called the Black Maternal Health Caucus that's being led by Alma Adams and Lauren Underwood. We've got Liz Miranda here in Boston. we've got a whole package of activity. It's a whole focus of Congress right now to try and address maternal health. And I've got colleagues who've been at this for 50 years, and they say they've never seen momentum like this to try and actually do something. So I just want to say that too. I've got a lot of hope. Like, we've got work to do, but like, now's the time to do it. Like, and we're making a difference.
On deck too.
Exactly. Yeah.
So I know you are busy, and I want to know what is next on your plate. What are you working on? Because I know you dabble in a lot. You're a huge activist, and you are boots on the ground when it comes to bringing this knowledge to the public. And so I just want to know, like, what's next for you? What are you doing? Because in my heart and in my soul, I see you, utilizing that public policy with your MD, with your MD. And, I could be just speaking things into your life, but I do want to know what is it that you're working on now?
I'm interested in organizing a movement. What I see happening in maternal health right now looks a lot like what I've read about what happened with HIV/AIDS in the early 80s, where there was a group of people that was disproportionately impacted by this new thing. But because society stigmatized them, nobody cared, even though they were dying. Like, the pharmaceutical companies were giving them leftover cancer drugs. It didn't work. The Reagan administration wasn't listening. And they got organized, and they changed the way research was done permanently in HIV/AIDS, so that you can't do that kind of work without a community advisory board. You can't do that work without talking about equity. And, they dropped mortality from HIV/AIDS by 70% in a couple of years by getting the community organized. So I want to change the idea that moms don't deserve to advocate for their own well-being, that you always have to, like, of course you love your kids and care about your kids, but you matter too. And moms are really good at advocating for other things. There's Moms Against Guns, Moms Against Drunk Driving. What we need is a movement that is by moms and for moms. And, I'm not a Black woman. We've talked about this. I don't have a uterus. And so I'm conscious of my own identity, but I think part of the opportunity is to have people like me that don't have that identity, that are allies, but have platforms and institutional power, like Harvard or being an obstetrician, that can stand alongside people that are doing the work on the ground in the communities. So that's where my mind is. And I'm looking to specific parts of the country that can be examples for the rest of it, like Tulsa, Oklahoma. A lot of my energy right now is in Tulsa, Oklahoma, because 100 years ago in 1921, they burned a whole neighborhood to the ground, and hundreds of people were killed and livelihoods were lost by the thousands. And they're just this year, 100 years later, coming to terms with that. And it seems like it was in the distant past, but Tayla, that same neighborhood right now, has the worst maternal health outcomes in the state of Oklahoma. That's the legacy of racism, right? Like the fact that we underinvested in that community, we destroyed the community, we, meaning the country, destroyed the community, underinvested in it. That made health and educational attainment suffer. And now the outcomes are suffering too. So places like that, Newark, Tulsa, Richmond, Virginia, places like that, where I think if we can do that organizing work and show what it looks like and make a difference, maybe we can create a model for the whole country.
Thank you for that. And have you begun this work already, or is this just foundational now?
We're doing it. We're in Tulsa. We're looking at some of these other cities I mentioned, but we've been in Tulsa for a couple of years now, laying the groundwork, because this isn't like, work that you do in a tweet. This is work that you do over years and a decade. But we've been in Tulsa for a couple of years now. I'm going to be there myself now that the pandemic is starting to calm down in May for the 100th anniversary of the 1921 race massacre. We're bringing a documentary crew. We're working directly with the hospitals that serve that population, and we're also working with an initiative that's based in the community.
So what does that look like? So the work that has not speaking for future or what will be done, but what has been done? What have you built already?
We design, and by we, I mean like we, so not just me.
Yeah.
But by any means, but like we worked with hospitals in Tulsa to design a program that we call Team Birth. But basically the idea is that every assessment of a person in labor, there are things that the mom should be told, and there are things that the mom should be asked. And we just basically defined what should be communicated between a nurse, a doctor, and a person giving birth during every labor assessment every time. And we created a system of accountability where you have to like write it down on a whiteboard on the wall that everybody can see. It seems like a really simple idea. We tested it over 2 years, and we showed that it makes it more likely that the moms that are there understand what's happening to them. They have the role that they want in their own care, that they feel like their input made a difference. And we're seeing improvement in outcomes too. So we did that at one of the hospitals, and now we're doing it in North Tulsa at the Hillcrest Hospital in Oklahoma State. In fact, we're going to launch those programs this month after several months of planning and training the clinicians up and things like that. And it's been bumpy, as you can imagine. Like, trying to address racial equity is sensitive. There's lots of opinions and lots of perspectives, and people who are into it and people who are deep resistors. But that's the work that we're doing. And we're also reaching out to the doulas in the community to think about how we can make sure that when moms show up, they know what this is. We're reaching out to some of the key community leaders, including some of the faith-based groups. So that's the work that we've started.
I remember when I gave birth to baby Rain at Beth Israel, we came prepared with a birthing. What is it?
Birth plan?
Yes, we came, and they actually put the birth plan on the whiteboard. And so,
yeah,
was that you? That you?
That's the thing that we're doing. Yeah, I mean, Beth Israel is my hospital, but we're trying to spread that everywhere.
As far as a birthing plan, because I know we're coming to the end of our interview, for those that are currently pregnant and don't have a birth plan, what is the best steps, or what should they consider when putting together a birth plan?
Well, I think, Tayla, the first thing I'd say is having an idea of what you deserve and expect is a good idea, but you don't necessarily have to carry the pressure of having a written out birth plan. I think the more important thing is to know in your mind what you want and communicate it, and do it early, like not when you're in labor, but like talk to your provider about it along the way. And they should and can talk to you about it along the way as things come up. And I think birth plans are often misunderstood in two ways. There's sometimes people think that it's about like mood music and candles, when it can be, and that's important, like whatever makes you comfortable. But it's also about things that are often really deeply meaningful to people, like how much do you want to move around? Because when you get an epidural, you can't do that. And how do you want your partner to be involved? Like things that really deeply matter to people. And then, circumstances can change. So I think that birth plans kind of scare people because labor and delivery is so dynamic that your ideal may not be what happens. And that's okay too, because what I've found is most people, they don't want absolute control. They just want to be able to, have things happen on their own terms. So if things change, they want to be part of it. They don't want to have things done to them. They want to have things done with them. So.
Well, I thank you for your time. And I meant to tell you this the last time we spoke, but could you please find out who was the nurse who stayed at, she was supposed to leave at 7. She did not leave at 7. She stayed until baby Rain came into the world. And I really, for his birthday, I want to send her a gift because I still think about her often. She was so amazing. And I truly, whoever she is, please know that she's one of the best.
I'm going to share what you just said with all of our nurses, because I think that'll make all their hearts sing. I think we've got the best nurses, and my nursing colleagues in general are amazing people. And that's exactly why. So that's just really lovely to hear.
Thank you. Thank you. So I absolutely love the work that you're doing. I appreciate you. Thank you for your time. You are always welcomed here for community conversation, and whatever it is that you have going on, please feel free to share with us. give loves and kisses to your two, and I definitely will keep baby Rain to know who his doctor is because he's fake.
Lots of love to baby Rain and to you, Tayla.
All right. Have an amazing day.
Okay, you too.
Bye-bye. I am Tayla Andre. Waking Up with Tayla Andre has absolutely nothing to do with the time of day we link up, but about waking up your third eye with unorthodox conversations leading to universal consciousness. It's because of Dr. Shah that I was able to have a VBAC. And for those who do not understand, I had a C-section with a Nari who was in distress, and so they had to get him out immediately. And then I had a C-section with a Saria 2 years later because at that time, even though like it was only 10, 12 years ago, at that time, it was believed that once a C-section, always a C-section. And I did not want to have another C-section. My stomach tissues are all messed up. I barely have any muscles in my stomach. I was like, I do not want another C-section. And he was like, Tayla, you don't have to. You definitely can do a VBAC. And so I am super appreciative for him just being as supportive as he was. And really breaking down what it meant for me to do a VBAC, what it meant as far as the risk are concerned. He's an amazing doctor. He's a great soul. I hope you guys enjoyed this show. 50% more. I am 50% more to die than my grandmother was when she gave birth. If that doesn't like scare the hell out of you, as far as the last 25 years, mortality rates, maternal mortality rates have been increasing. Well, we're over here talking mad ish about any and every other country. It's just like, the mortality rates and like what's going on in your own backyard. We are working on it, and shout out to Dr. Shah, who is doing the work in Tulsa. I definitely will continue to follow his work just because he is Baby Rain's birthing doctor. He's not Baby Rain's actual doctor today, but that's who we went to when I was pregnant, and he's dope. And the work he does is dope. And I'm super excited to have that relationship with him, to be able to share with you the facts and the truth about maternal mortality rates in America. And so I thank you. I love you. I appreciate you. I hope you guys have an amazing day today. Y'all know what tomorrow is, right? What's tomorrow? Freaky Friday. I don't know how Freaky Friday is going to work tomorrow because Baby Rain doesn't have school. So we might be at home butt naked in the bed tomorrow. So Freaky Friday might be me in the bed naked. That might be tomorrow's conversation because I really am not bringing him in the studio. That is not going to happen. But I still want Freaky Friday since we didn't have Freaky Friday since I jet set it and left y'all. I thank you. I love you. I appreciate you. The truth, he ain't got to convince me of nothing. I know the facts. I know the truth. I know what's going on with the mortality rates here in America. I was actually the reason why. So we didn't even discuss this, but the reason why him and I have the relationship that we have is because when I was pregnant with Baby Rain, I did make a complaint and I felt like he wasn't listening. And so we had a real conversation about like, yo, how you on Instagram talking about doctors need to listen to moms and yo, you ain't listening to what I'm trying to say. And he was like, you know what, Tayla, you right. That's how it started. How it's going. And so we definitely didn't start with the best relationship, but through communication and honesty, we were able to build to where we are today. So the truth, there's nobody have to convince me of anything. I'm well aware. I am totally in tune. I am tapped all the way in. And when you see a spade, you call a spade a spade. And he took full ownership and went ahead and we had a conversation. He righted his wrong and we kept it moving. And so nobody have to convince me. I am convinced that, even in the field, even knowing what you know, balls do get dropped. And he definitely picked mine back up and was fully aware and fully conscious of, knowing that some things needed to change. And I have nothing but good things to say as of now. So how it started, how it's going. The real medicine is food and also the lifestyle you live. And that's absolutely correct. And prior to this conversation with Dr. Neel Shah, we had a conversation shooting the ish with Bambi. And Bambi was talking about Immunotech and Immunical and how Immunical is food for your immune system, and how she has witnessed people regain their sight. She has witnessed people with lower cholesterol, lower blood pressure, individuals that have been had HIV and now HIV is undetectable. They can't use the word cure as far as Immunical is concerned. But if you have anybody that has any type of ailments, or she said that she took it while she was pregnant, it helps with rebuilding cells. So if you know somebody who's trying to get pregnant and hasn't been able to, she's witnessed people be able to have, more fertility after using it. And she taught us that Immunotech, Immunical is the product, Immunotech is the company. And if you ask your doctor for a prescription of Immunical, you go ahead and you send it over to the company, Immunotech, and you pay for it, and your insurance will reimburse you, or if I'm correct, they reimburse you after your insurance pays. And so if that's something that you're interested in, trust and believe. I was unaware of that. I'm making a phone call today to see if me and the kids can all get a prescription. And so I am Tayla Andre. Waking Up with Tayla Andre has absolutely nothing to do with the time of day we link up, but really having conversations that most people aren't having. These aren't your Friday night conversations. These are really You right. He said, Tayla, remember Dr. Seppi helped people with food, only food. He had them move away to the tropics for a while to regain your health and your power. And that is a very hard reset. A reset from the BS water that you're drinking, a reset from the BS food that you're eating, from the mentality of all of the outside world of effing with your frequencies, messing with your soul. So yes, I am very aware. And they killed Dr. Sebi. And I can't wait for the documentary to come out about how Dr. Sebi was in the federal court on a federal level, not a state level, on the federal level. And they were trying to shut him up because they were like, you can't say you cured AIDS. You can't say you cured cancer. And he fact. And they were like, oh, you did cure AIDS. You did cure cancer. All right, we throw out the case. You could continue doing what you were doing. But they took his life, though. They absolutely took his life. And you want to know what they took his life with? The food. So look at the irony in that. Isn't it ironic? No, it is not. So we are going to continue to have unorthodox conversations leading to universal consciousness, because these are the things in which we need in order for us to grow as a community, as a society. And I just want us to be mentally, emotionally, spiritually, financially. I just want us to be free. And you can't do that if you don't have an understanding and a knowledge of self and a will to want more and to have better. And so that is where we begin, but that is not where we end. And so we continue. For those who have not, or this is your first time tuning in, we on Motivational Mondays, we get you and your soul ready for the rest of the week. On Friday, I'm a whole human. I like sex. I like freakiness. And so just as much as I need my spirituality, I need my sexuality. And if you're a whole human, so do you. And so I hope you have an amazing day. I am Tayla Andre. Everything Tayla Andre is www.taylandre.com. If you don't know, we got over 2,000 hours of knowledge on YouTube. So if you're watching on Facebook or if you're watching on LinkedIn, head over to YouTube, TAYLAANDRE. I have a book for people preparing for first-time home ownership. If you know anybody who needs to fix their credit or just wants to get an understanding of how am I supposed to buy a house? I don't have no savings. I'm not even working. I have this issue. I have that issue. Where can I buy? The book covers any and everything that you have as far as questions are concerned. And it has my number in it and my email address. So if you need help, I am here to handhold you. And so I thank you. I love you. I appreciate you. And I hope you have an amazing day. Freaky Friday is tomorrow. Mwah.